All right, thank you. Hi, everybody. I'm State Senator Jason Lewis. Thank you so much for joining us for our virtual town hall this evening. I want to thank Tom Dalton from my team for organizing tonight's event. Here's the plan. I'm going to share some brief updates, and then Tom and I will present the results of our recent constituent survey. I think you'll hopefully find that interesting. And then the bulk of the time that we have together this evening, I look forward to taking your questions and hearing your feedback. Please type any questions that you have for me or any comments or feedback directly into the Facebook comments. And Tom will be keeping track of those, and he will display them as a banner on the screen so we can all see the questions, and I'll do my best to answer them. You know, we're planning to basically go for about an hour this evening, but certainly if you have more questions that we haven't addressed yet, we will go as long as we need to make sure everybody's feedback is heard and questions are answered. All right, so let's dive in. You know, of course, given the world we're living in right now, we, need to start the town hall, I think, with some thoughts about where we are with the COVID-19 pandemic. Almost 2/3 of our cities and towns in Massachusetts right now do fall into the highest risk level, the so-called red category. We are continuing to see, very high daily case numbers. Although in the last week or so, they have started to come down a little bit. And fortunately, death rates are much lower now than they were when we had the first surge last spring. And I think that's largely due to the fact that our hospitals, which have been doing an incredible job through this entire pandemic, are better prepared now and better able to treat and manage severely ill patients with COVID. Of course, nothing is more important right now than getting everybody in Massachusetts vaccinated as quickly as possible, with appropriate priority going to those populations who are most vulnerable to this virus. Both our state legislature and the United States Congress have appropriated funding to help support the development of the vaccines and the rollout and infrastructure needed to actually administer the vaccines. But we definitely recognize that significantly more resources and support are definitely needed. And for that reason, I'm very optimistic with the new Biden administration and how seriously they are taking this pandemic and how committed they are to expanding testing, contact tracing, resources for treatment, and most importantly, support for states and localities in distributing the vaccine as quickly as possible. Let me say that I absolutely share and understand the frustration and stress that I know is being felt by so many of our residents about the pace of the vaccine distribution in Massachusetts in particular. And more than that, even the lack of clear information about when, where, and how different populations, different groups are going to be vaccinated. I can assure you that myself and other legislators have been sharing these concerns, serious concerns, directly with Governor Baker, Secretary Sutters, who is our Health and Human Services Secretary, and other senior officials. And in fact, last Friday, I met along with other senators directly with Secretary Mary Lou Sutters for over an hour. And, she heard all of the concerns that we've been hearing from our constituents. And there were a lot of concerns even before last week. And last week, of course, was a debacle with the rollout of the vaccine to seniors 75 years and older. So Secretary Sutters and the governor have committed to taking immediate action to address a lot of these shortcomings, both in the online sign-up process, which has been very difficult to navigate, opening a call center to make it easier for people, particularly our seniors, to sign up to get vaccinated, and other steps around communication that need to be taken. Of course, the biggest factor that's out of our control, which is largely up to the federal government, is actually how many doses of vaccine that we are receiving each day and each week. And that is definitely continues to be one of the major limiting factors. So again, that's why we're very hopeful that the Biden administration will find ways to accelerate dramatically the manufacturing and the distribution of all available vaccines so we can get them out and administered to residents as quickly as possible. The best source of information on vaccination plans, who's eligible, what to do, where to go, how to sign up, continues to be on the mass.gov website. So we continue to encourage folks to check the mass.gov website. There's a map of the state, which is where you should start. If you have any difficulty finding or navigating that, certainly contact my office. Best is to email us, and we will do everything we can to assist you. Also want to mention that we have, my office has put together a number of resource guides. One is for individuals, all different kinds of resources that are available for those who are struggling during the pandemic. Second resource guide is for small businesses and nonprofits, another group that's been extremely hard hit by the pandemic. So that is we brought together all different available federal and state resources for those small businesses. Third resource guide we put together is to help those who are in need of unemployment assistance and how to navigate the unemployment process. We know that's been challenging. And the fourth resource guide is for housing assistance for those who are facing housing insecurity, what resources and options are available to you. So please, Tom is going to put those links in the comments, but we want to make sure folks know that those are available and that those can be helpful, and that my office is a resource. And also our state representatives in our communities are a terrific resource as well, their offices. So we encourage anyone who has questions or has needs or is struggling during this very difficult time to please reach out to us. Finally, I wanted to mention that we are planning to hold a special virtual forum aimed at providing assistance to our small businesses and our nonprofits in our communities. We are very fortunate to be joined by Bob Nelson, who is the head of the SBA for Massachusetts, that's the Small Business Administration, and also by Larry Wheeler, who's the president of the Massachusetts Growth Capital Corporation. So both will be joining me next Wednesday, February 10th at 8 a.m. For those who are early birds, to discuss federal and state programs and resources available to help our small businesses and nonprofits. So again, there on your screen, you can see when that is. Please RSVP so we can get you the Zoom link for that event, but that's very much looking forward to that. Let me give you a quick update on what happened at the end of the last legislative session, which in Massachusetts, we have 2-year sessions. And the previous session ended on January 5th. Actually, technically, it ended very late at night, so it was actually January 6th at that point. But the end of the session was very busy and unfortunately very productive in what we were able to get accomplished in the legislature and working with Governor Baker. So just very quickly, some key bills that made it all the way through the legislative process and were signed into law by the governor. First, major police reform and accountability. It's a significant racial step forward for racial justice in our state, and we actually think this bill will be a model for a lot of other states that are also looking to strengthen police standards, training, and accountability, and address related racial justice issues in law enforcement. So very pleased that got done. The Roe Act was passed into law. Actually, it was over Governor Baker's veto. We overrode his veto. And this bill significantly strengthens women's reproductive rights and access to reproductive health care, so that no matter what happens at the national level, no matter what the Supreme Court does to undermine Roe v. Wade, those rights are fully protected here in Massachusetts. Another major bill is aimed at helping to spur our economic recovery. from COVID, and also to spur more affordable housing development in our state, which was a major need, obviously, even before the pandemic. That legislation is providing over $600 million in investments in a whole host of different programs that support our communities, small businesses, nonprofits, workforce development, and so forth. It also places a cap on restaurant delivery fees. That was the number one thing our struggling restaurants have been asking us to do. It includes a student loan borrower's bill of rights, which is a significant step to help many of our young people who are still dealing with high student loan debt. So there's a lot of other things in that bill, but that was also passed and signed into law. We also enacted, and the governor signed, a very significant transportation infrastructure bill. It invests more than $16 billion over the next 5 years in transportation infrastructure, including roads, bridges, and public transit, including the MBTA. And also on the topic of transportation, we were successful in convincing the MBTA to restore some of the cuts that they had proposed back in November that would have had a very devastating impact on our communities. So we were able to get them to keep Cedar Park Station open, to restore some bus routes, local bus routes that they've been planning to cut, and also to make sure that the Winchester Center renovation project is going to continue to move forward. They were proposing to shelve that. So those are very big wins for our district and our communities. And I want to thank many of you who advocated during that process for helping us to convince the MBTA to not make those short-sighted cuts. Another major bill that passed deals with healthcare, affordability and accessibility of healthcare, and specifically it includes making permanent access to telehealth, which has been so important during the pandemic. So going even after the pandemic, making sure that telehealth services continue to be convenient and affordable for our residents to take advantage of. And then finally, there were two bills that passed and were signed by the governor that I'm particularly excited about because I was the lead Senate sponsor of these bills. So I was really heavily involved in championing them. The first one deals with the very debilitating illness known as PANDAS or PANS. And it strikes children. And it is really, for those not familiar with this, it is truly an awful illness. And unfortunately, there has not been universal insurance coverage for all the treatment options that children and their families need when struggling with this illness. And that's why this legislation that we passed is so important, because it will make sure that everyone who needs it has access to the treatment, all treatment modalities. And I want to give a particular shout out to a constituent in Melrose, Sheila Gausch, and Sheila's family, who were instrumental in first educating me about the seriousness of this illness and what needs to be done to help these families, and also in helping lead the campaign that after a number of years helped us to get this legislation across the finish line. And then the second bill that I championed that also we were very happy was signed into law, only took us 35 years, is the bill to redesign our state seal and flag, which if you're those familiar with it know that there's been longstanding concern from Native American leaders and others that our flag is very insensitive at best and racist at worst in its imagery depicting Native American figure with a sword above his head. That bill was first filed by a mentor of mine and a friend, civil rights leader and former state representative Byron Rushing. And he filed it first in 1985. So I was thrilled that we were able to get that bill done. And now the Special Commission will be redesigning a new state seal for Massachusetts. One unfortunate note was the climate bill, major legislation to advance our clean energy and climate agenda in our state was passed on a bipartisan basis by the House and Senate, but was vetoed in January by Governor Baker. The House and the Senate moved very quickly in the new legislative session to refile essentially the exact same bill This is quite unprecedented. And we actually debated and passed that bill just a week ago. So we have now sent the same bill back to Governor Baker's desk, and now we will make sure that that bill does get passed into law one way or the other in the coming weeks. So that's going to be a top priority for the beginning of the new legislative session, that climate legislation, to make sure Massachusetts is doing everything we can to help combat climate change moves forward. So that's a good segue into the new legislative session, which started January 6th. And all of the state representatives, state senators were sworn in. We did that mostly virtually because of the pandemic, but the new session is now underway. And in order to help me and my team, put together our legislative agenda and our top priorities for the session, we put together a survey, and we shared that survey with all of you, and we were thrilled with the response we got. And so we want to share the results of that survey now for the next 5 minutes or so, and then after that we're going to open this up for your questions and feedback. All right, so Tom, let's go ahead and share the survey results. So it's going to come up on the screen, and Tom's also going to put the link in the Facebook comments, so you'll be able to take a look at this afterwards if you want to look more closely. So the survey, as I mentioned, was for constituents who live in the 5th Middlesex district. That's the Senate district I represent, and that includes Malden, Melrose, Reading, Stoneham, Wakefield, and Winchester. We put this out there for about a month, so there was plenty of time for folks to respond. We shared it on social media, local news outlets, so hopefully people knew about it. We got 319 total respondents, and so that's great. Though we do have to acknowledge that the survey results are obviously not intended to be statistically significant. We were not able to do random sampling of our constituents. But we do think that the survey results provide a helpful indication of what's on folks' minds, what are their chief concerns and priorities for the constituents that I represent. And I can assure you that my team and I will be using these results, as an input, again, as we finalize our legislative agenda and our top priorities for the legislative session that is now underway. We are certainly enormously grateful to everyone who took the time to respond to the survey. So thank you very much to those who are attending our town hall tonight for filling out the survey. All right, so Tom, let's go to the results. So we basically asked the question, as you can see at the top of the screen here, for each of the issues that are listed, please indicate, how important the issue is to you. And we did this on a scale of 1 to 5, where 1 is most important, that issue is very important to the individual responding, and 5 would be least important. There were 24 issues that we came up with, that are issues that we think are important and that we have, worked on before. And we know we've certainly had many conversations with constituents about. So we came up with the list of 24. Obviously, there's no magic number. We could have had an even longer list, but those were all listed in the survey. And then again, we were asking respondents to go one by one and sort of give a score of importance for each issue. So what Tom then did was calculate an average score, which you can see in the average score column. And then we rank ordered each of the 24 issues based on their overall average score from 1 to 24. So if we sort of focus first on the top 10, I don't think it'll be any surprise to anyone that the top issue by far is addressing the COVID-19 pandemic and including rapidly distributing vaccines. I think we would all be surprised if that wasn't the top issue in our communities and everywhere in the state. And rest assured that has been our priority for the last year and will continue to be so, until we are all the way through this pandemic. So both addressing the public health impacts of the pandemic and also the economic and social impacts of the pandemic on our communities as well. The next category, I would say, that's the most the highest priority in the survey is basically in the what I would put in the bucket of healthcare, sort of more accessible, affordable healthcare. We see this in terms of number 2, which is specifically about addressing healthcare affordability and lowering drug costs. Also, number 5, improving mental health care and substance disorder treatment. And number 7, safeguarding a women's reproductive rights in healthcare. So I'd put kind of those 3 together generally into, strengthening healthcare. And as many of you know from conversations we've had before, I personally view healthcare as a human right. And I strongly believe that everybody should have access to the care they need from cradle to grave. And that should be a universal right in our state and in our country. The next bucket, I would say, of issues is around economic recovery, helping our small businesses, and job creation. And again, not surprising that this would be a high priority for respondents, given the devastating impact that the pandemic has had on our economy, on our communities, lost jobs, the number of small businesses that are struggling, the nonprofits that are struggling, and so on. So definitely understand that's a high priority. Another thing that's jumped out at me that's sort of high priority, at least in the top 10, is our environment. We see that both number 10, combating climate change, and number 8, generally protecting the environment, environmental sustainability, reducing plastic waste. So that, again, is consistent with a lot of the advocacy we've been seeing in recent years, that combating the climate change and environmental sustainability continues to be becoming an even higher priority issue for more and more people. Rounding out the top 10, we see number 3 around improving state government transparency and accountability, which was also continues to be an important issue for me as well. And number 9, increasing funding for public schools. We were very pleased that in the last legislative session back in 2019, we successfully passed the Student Opportunity Act, and that will be investing about estimated $1.5 billion new dollars in our public schools, particularly those that have been most disadvantaged. But of course, we have to now implement the Student Opportunity Act and make sure that that funding is actually appropriated, through our annual budget process. So important to keep that certainly high on the list as well. So that's sort of my thoughts around the top 10. Tom, if we go to the next page, we can sort of see some of the other issues that, in many cases are, ranked almost as high. I mean, if one thing that struck me was how many issues really are priorities for so many of our residents. I mean, there's very little difference in many cases between what's in the top 10 and just below. So certainly, continuing to address racial justice issues, not just in policing and law enforcement, but in housing and economic development, environmental justice, higher education, the affordability, and early education and childcare as well. And we can talk more about that during the town hall, but I'm excited to be working with the Common Start Coalition. We're going to be rolling out some major new legislation to help make access to affordable childcare and early education universal in Massachusetts. So that's going to be some exciting work coming up this legislative session. Continuing to work to increase affordable housing supplies is another critical issue. Of course, improving MBTA service is certainly shows up there. And you can see the rest of the issues again on the screen here. And again, feel free to take a look at this. Tom did put the link in the comments, and continue to welcome your feedback tonight and during the town hall on these or other issues. And then obviously subsequently, if you want to call or email us or come and meet with me at office hours, which we have every other Friday, we're again always welcome hearing your feedback on what's most important to you and your families. All right, so I think we'll wrap that up there. And so Tom, let's switch over to our questions from our town hall attendees.
Great.
Look forward to answering them.
Great. So we've already got a couple questions, and we definitely encourage folks to leave their questions in the comments, and we'll try to get to as many questions as we can. So I'll remove myself from view and start displaying some of our questions.
All right. Question from Alan about ranked choice voting. Thanks, Alan, for the question. I was disappointed, as I know many of you were, that, the proposal to adopt ranked choice voting in Massachusetts wasn't successful at the ballot last year. I did champion it, and, a lot of people supported it, obviously, but it didn't succeed at the ballot. So I have to be honest with you, it's probably unlikely, that the legislature is going to take up ranked choice voting right now, because once something has gone to the ballot, and particularly, obviously if it's failed at the ballot, legislators are kind of loath to take it on, because obviously the voters have weighed in here and have said this is not right now something they want. So unfortunately, I don't see ranked choice voting, certainly at the statewide level, going forward right now. But, in the future, in future legislative sessions, that certainly could be reconsidered. All right. Hi, Maya. Thanks for this question. Let's see. About job loss.
So I know we're a little cut off here, Senator, but it's a question about how the job losses in December.
Yes.
It's been reported that basically all of the job loss in December can be accounted for by women who've lost their jobs in the United States.
Yeah, thank you, Maya, for raising this. It really is shocking and shameful. First of all, nobody wants to see any job loss at all, of course. But the fact that the job loss we've seen during the pandemic has so disproportionately impacted women and people of color, and what we are now referring to as essential workers, and often ones who are losing their jobs and are on the front lines. So there's no question about that. And, there have been a variety of complicated reasons for that. One relates to the lack of access to childcare and early education. And that's been, unfortunately, has disproportionately impacted women who've dropped, in many cases, had to cut back or drop out of the labor force because of childcare needs. And is one of the reasons why I think this will be a priority to address in this new legislative session. But I think it generally speaks to the need to redouble our efforts that we were working on before the pandemic, but maybe not with enough boldness or urgency around pay, gender equity when it comes to pay and job opportunities, and a broader racial justice agenda. As I talked about, I'm very pleased that we were able to get police accountability done in Massachusetts. That's just a very big step forward for racial justice, but systemic racism is so deep-seated and has been with us for hundreds of years and impacts so many different parts of our society, certainly within our economy and employment, but also within housing, transportation, healthcare. So there's a lot of work we need to do. And, if there's any silver lining from the pandemic, I think it has shone a spotlight on these kinds of inequities and disparities, again, that were there before the pandemic, but have been exacerbated. And so I'm very hopeful that it's going to create momentum, both in the legislature and among the public, to take much stronger action to address, healthcare disparities, again, housing disparities, environmental justice issues, and economic justice issues more broadly. Looks like we have a question from Finn about the Fair Share Amendment. Yep, thanks for bringing that up. I am confident that the legislature will advance the Fair Share Amendment to this session to the ballot. So for those of you not familiar with it, this is sometimes known as the millionaire's tax. but it proposes to put an additional 4% income tax only for those households who earn more than $1 million a year. And that would be indexed to inflation over time. So that revenue that would bring into the state would be critical for increasing our investments in K through 12 education to fulfill our commitments to the Student Opportunity Act, also to support affordability in higher education and early education. And then it could also be used for transportation investments. Those are the areas. So it has to be voted. It's a constitutional amendment. So it has to be voted on by 2 successive sessions of the state legislature, and then it has to be approved by the voters at the ballot. So last session, we voted on it in the legislature. It received overwhelming support. And now it will have to be voted on again during this session, again, which I'm confident we will do. There's so much support for it. And then at that point, it will then go on the ballot in November 2022. And we're going to need hopefully a good, strong grassroots campaign, make sure the public understands what it is and why it's needed, and why this is a fair and progressive way to raise the revenues that our state needs to make the investments that we need in our future. So that's where it currently stands right now. All right, question from Kimberly about vaccine distribution. Fenway's vaccinating 5,000 people a day. Okay, so generally with vaccinations, the main constraint has been and continues to be the number of doses that our state's receiving from the federal government. So basically almost all the distribution of vaccines is coming from the federal government, and they procure it and then they ship it to states. So we've been, and this is true in other states too, have been very limited in the number of doses, and that's the main thing constraint. But beyond that, there's no question we've not done a good job in Massachusetts with our rollout, and that includes communications with the public, and also just making sure people know, when they're going to be eligible, where they're going to be able to go to get the vaccine, and how they're going to be able to get the vaccine. And that really came to a head last week when, seniors 75 and older became eligible, and they were told to go sign up online, and the website was a debacle, and so difficult to navigate. So we're trying to urge the governor and the administration to address all those issues right away, and I think we will see improvements in the coming days. So it's easier to sign up. There'll be more sites open for sure, where people can go. So there'll be the mass vaccination sites, but also local sites, local clinics in our communities. For example, there has already been a clinic, at least one in Wakefield last week, I believe, and there's also coming up in Melrose at Memorial Hall. So there'll be a number directly in our area. But again, the main thing that's going to determine how many doses can be administered is going to be the supply we receive from the federal government. So again, that's why we're very hopeful that President Biden's administration is going to do, everything they can to increase the number of doses that are manufactured and distributed, as quickly as possible. All right, Zeta's question is funding of the Student Opportunity Act. Yep, thanks for bringing that up. As I was mentioning before, it was a great victory to pass the Student Opportunity Act in late 2019 and have the governor sign it. But of course, that's not the end of the process. We need to now deliver on the commitment, to fund it, and the law requires that it be funded over 7 years. So the fiscal year we're in right now, unfortunately, because of the pandemic, we basically are treading water. So that was very disappointing. But the governor's budget for the next fiscal year, for fiscal year 22, just came out at the end of January, and he does propose to fund the first year of the Student Opportunity Act. I have some concerns with some assumptions the governor made in his budget, particularly around how we are counting enrollment in our public schools, because 30,000 students have left the public schools. But most of them will probably come back in the fall, and the governor's budget doesn't take that into account. So we're going to be having some I'm sure some conversations about that in the legislature. I do serve on the Senate Ways and Means Committee as well, and we're going to be looking hard at how do we make sure we fully fund the first year of the Student Opportunity Act, this fiscal year, because we need to make sure we're committed to implementing that new law. One other final thing I'll say in terms of the available revenues to the state to help not just fund the Student Opportunity Act, but to increase funding for housing supports, homelessness prevention, food security, our social safety net generally. We are very dependent on what happens with state tax revenues, but also very dependent on what happens with the federal government. President Biden has proposed a almost $2 trillion coronavirus relief bill. If that does get through Congress, and we know Democrats in Congress are going to push hard for it, that would make a huge difference for Massachusetts, because we would be getting funding directly to the state and to our municipalities that would then allow us to have a much more generous, state budget for fiscal year 22 than would otherwise be the case. All right, Tom, what's our next question? From Lauren, proposing to help people afford childcare. Okay, great. Thanks for this question. So right now, even before the pandemic, we have not made early education, childcare, out of school time the priority that it should be. For example, we treat it very differently from K through 12. K through 12 is viewed as a public good. It's publicly funded. Every child has access to public schools. Certainly, we know that there's been major inequities in opportunities, but it is still a public good. We have not had that with childcare and early education. The pandemic has shone a spotlight on how critical, high quality, affordable early education and childcare is, because not just for the well-being of our children and our families, but it's also a critical workforce issue for our economy. So the legislation that we're going to be filing next week, actually, I'll be the lead sponsor in the Senate, along with Senator Susan Moran, who's a new senator, and then there will be partnering with some fellow state representatives as well who will file it in the House, is basically very bold and ambitious, and it basically would look to transform our current system to provide universal access to affordable early education and childcare for all families. So it's not looking to in any way dismantle the system we have, because we have a very a mixed delivery system today. Some is private, some is nonprofit, some is through family childcare, like Lauren, what you provide. Some is through center-based, some is delivered through schools. So keeping that, but providing, first of all, understanding that we need to treat our early educators as professionals, and we need to work to increase the pay scales and benefits so that they're treated more like our K through 12 workforce. So that's a critical piece of it. And then the other piece is making sure that families can afford quality care. So the idea would be to offer a sliding scale of subsidies. So the very low income families would essentially have the expense covered for them. So that's largely like the system we have now. But then as your income goes up, you would still be eligible for subsidies up to a certain point. So in other words, it would make it much more accessible for middle income families as well to get the childcare and early education they need. Obviously, this will take a lot of money, and we know that that's not available immediately. But the idea is to put in place a system and a framework. So as we receive more federal dollars, which I think will happen in the future, and also as more state dollars become available, like, for example, through the Fair Share Amendment, we can continue to roll out both so on the subsidy side for families and also on the provider side to make sure that we treat our providers like the professionals that we should. And that, again, they have the pay, the benefits, and the materials and other, everything else that's needed to provide, high quality childcare and early ed. So stay tuned. We're going to have a lot more information starting next week on this. And again, I'm working with a coalition called the Common Start Coalition. It involves a lot of different groups from all over Massachusetts, including the business community. So, we're very excited about that. All right, question from Sue around disability issues and access. Yep. Yes.
And Senator, the part of the question that's a little bit cut off is asking specifically about making sure that vaccination sites are physically accessible for people with disabilities.
Right. Great. Thank you, Sue, for always raising these issues, and I'm so pleased, grateful that you do, because in a number of cases, in the past, you've contacted my office and spoken with us about accessibility issues, whether it's online or in the physical world, and we certainly try then to follow up and address those issues. So totally agree with you. Certainly when it comes to the online issues on mass.gov and on the vaccination sites, that's been part of the problem is it has been accessibility issues. So definitely when we had the meeting with Secretary Mary Lou Sudders last Friday that I mentioned, that myself and other senators met with her, this was one of the issues we raised is lack of accessibility, for those with different kinds of disabilities. She heard us. Language barriers is another concern related to that in terms of having access in multiple languages. So I do believe the Baker administration, is going to, we need to hold them accountable to that, but that they do listen to that feedback and make those necessary changes. And then in terms of sites being accessible, that's good feedback as well. I would hope that the sites that are being opened, that is one of the criteria, is that it be, accessible to all, in order to serve as a vaccine site. But if that is not the case, definitely let us know, and we will be sure to follow up with, the appropriate people about what can be done about that. All right, let's see. Matthew Gold's question, how about mobile delivery for those seniors who cannot get out of their private ring? Yeah, so, this was one of the things that was so frustrating and continues to be about the vaccine rollout specifically for seniors, right? Until last week, until this week, we weren't vaccinating seniors yet, so it was very specialized populations like hospital workers, first responders, people in congregate care settings. So we had kind of a special plan for each of those groups. Again, it's far from perfect, but at least that made some sense. But when it was rolled out, starting available to seniors 75 and above this week, that was clearly where things broke down, and we did not have a good plan. It wasn't well thought out. And one of the main, deficiencies in that is that, somebody who's 80 years old, 90 years old, it's going to be really difficult for them to get to, Gillette Stadium or Fenway. They may have issues with mobility, accessibility. They may have issues with getting transportation. It's going to be difficult for them even just to sign up, as we discussed. So being able to stay in their own community, and our local councils on aging, they know their seniors best. They often have a good sense of the seniors who are most frail, homebound, may need assistance. So that was one of the major messages we definitely have been delivering to the governor and Secretary Sudders and their team, is that, particularly for the population of seniors and particularly older seniors, I totally agree with you. We need to make sure that the options for getting vaccines, it's fine to have the mass sites. Maybe that works for some people, but for most seniors, it's going to need to be locally, local Board of Health clinics or other local ways. I don't know how feasible it'll be to go individually to people's homes. Maybe in some cases we can, but certainly if it's a local clinic in the community and transportation can be arranged through the Council on Aging or the Senior Center, to get somebody to the clinic and get them back home again, that's much more doable than getting to, to Gillette or Fenway or some other, distance site.
Senator, I would just add that in our communities, I know that Mystic Valley Elder Services, which is based in Malden and serves the communities in our district, they are offering rides to any senior who needs to get to a vaccination site, who has a vaccination appointment that they can't get themselves to. So that is a resource that's certainly available for our seniors in the 5th Middlesex.
That's a great point, Tom. And definitely, anyone who is a senior or if you're trying to help a parent or a loved one or your neighbor, definitely Mystic Valley Elder Services is a resource. Local Council on Agings are a good resource, and boards of health, and also certainly my office or our state representatives' offices as well. And we'll do everything we can to try to connect the senior, with a site and the logistics of that, and figure out a way to get him or her vaccinated. All right. Question from Michael. Independent practice for nurse practitioners. So thank you for mentioning that. Allowing our healthcare professionals like advanced practice nurses to practice at the full scope of their license had been something that I'd been pushing for years, and many other people had as well. And that's another small silver lining from this pandemic, that we were able to push and get that legislation finally through, and governor signed it. That was a part of the same bill that included the making telehealth permanent. So thanks for noticing that. I know that's been a big deal for a lot of our nurse practitioners, nurse anesthetists, and so on. The rest of your question, I think, was about sort of how do we continue to build on that. And, I think we just going to continue to push, and as we continue to show success, with expanding, again, it's a key part of expanding access to quality, affordable healthcare in my mind. A good example of where, I think we need to do this is in oral healthcare. There's a proposal in Massachusetts for dental therapists. It's a model that exists in Minnesota and other states. It's kind of a mid-level dental practitioner, and it's a great way to expand access to oral healthcare, which we have a serious shortage, particularly for low-income people and communities of color, access to the oral healthcare they need. So that's a good example of where we could serve that. So that's legislation the Senate has passed before, just hasn't made it to the governor's desk yet. So that might be a good example of something, again, that we can use this pandemic to create more urgency and momentum for legislation like that really is critical to accessible healthcare. All right. Looks like Alan has another question around education funding. The National Guard's Challenge program. I think I would need to learn more about that. So unfortunately, this format of Facebook Live makes that a little bit difficult. But maybe Alan, if you want to put a little bit more about that program in the Facebook comments, I can read it. Or if you want to follow up with my office, maybe we can talk further about that program and how it works, and what I can do to be supportive. All right. Let's see Maya's question. Okay, around a very important question here on how we're doing when it comes to equity and racial justice. Great. Thanks for asking this. I think that our communities have a lot of work still to do. I don't think they're unique in that. I think that's probably true almost everywhere. But there's a lot of work to be done to advance diversity, equity, and inclusion, in all of our institutions throughout our communities. I am, excited about the work that is going on. There's some very good work going on in Malden, Malden Core, and in the schools. Same is true in Melrose. Some terrific work being led by the Network for Social Justice, in Winchester, again, and throughout my district. But everyone recognizes there's a lot more that needs to be done. A piece of legislation that I'm very excited about which came to us essentially through a grassroots effort, as starting in Malden, but I think the coalition that's been built now includes people from Boston and Medford and other communities. But basically, essentially, it's to find a way to accelerate our efforts around racial equity and racial justice in our schools. So this could include curriculum materials, training for educators, and also critically important greater diversification, of our educators and our administrators. There's a lot of research that shows that for a student of color, having just one teacher of color in his or her, time in school has a significant positive impact in a variety of life outcomes. So this is something is a critical need we have. So the current plan that we're working on, and it's legislation that we're getting ready to file, would create a special standard with wide diversity of membership to help support these efforts in our schools and to complement some of the work that our Department of Education is doing, but to really help support and accelerate those efforts in our schools. And number two, we would also create a special public-private trust fund. So we would aim to put some public money in and also philanthropic and private dollars. And that would allow us to give grants to schools and school districts to accelerate this work at the grassroots level. So I'm excited about that, and so we're going to file that legislation also in the next week or two, and welcome, support and folks getting involved around that issue as well. And I expect won't just be the bill I file. There'll be a lot of important racial justice bills, dealing with our schools, dealing with healthcare, housing, and economic justice issues that will be filed, and we need to make those a priority this session. Okay, question about CARES Act funding allocated for testing in schools. So what's happening with COVID testing? Schools are certainly able and allowed to use some of the CARES Act money that they've received, and schools are about to receive about $700 million more dollars. That is as a result of the bill that Congress passed at the end of December. So there's both the CARES Act money back from last March, and then there's the bill in December that has been flowing, much of that directly to school districts, actually. And they certainly can use that for testing, as well as, they've been using it for personal protective equipment, for staff shortages, a whole host of things to meet the challenges they've been facing. What the state has rolled out more recently is a pooled testing strategy. So this is a way to pool a number of individuals, and their samples are all tested together. If they're all negative, then nothing further needs to be done. But if it comes back positive, then each of those people in the pool then gets subsequently individually tested. So it's a very cost-effective way to do wide-scale surveillance testing, and that has been rolled out now in school districts that want to participate can do so. And in fact, the first 6 weeks are being provided free of charge to school districts, the state's picking up the full cost. But after the 6 weeks, the districts would have to cover the cost themselves. So I know a number of them are looking at what that would entail. But again, that additional federal stimulus money that's going to be distributed, in the next week or two, again, a total of about $700 million. So it is a lot of money, could be used for this purpose if school districts feel that that's important to help keep everyone safe and get students and teachers, back into classrooms for more in-person learning. Yes, indeed. I agree. A lot of great questions from everybody attending the town hall. So thank you so much for everyone's questions, and keep them coming. So let's see. Transportation will likely be an issue for folks, who have disabilities. Okay. So, I see your question is getting at for the next group of people who have two or more comorbidities and are now, to get their vaccinations where they have mobility and transportation issues. So that's a really good point. Yeah, we're going to have to deal with that. And some of the same issues, I guess, that, we are dealing with, frail elderly, frail seniors in terms of how they get their vaccinations. And again, it strikes me, this is something we need to probably think more and talk more about, but it strikes me as having those vaccination sites as much as possible in the community, whether it's through the, probably run by the local boards of health, is going to be the best way to vaccinate those folks who do have serious health issues, serious mobility and accessibility issues. And making sure there's transportation options available for them. So that's a really, really important point. And I'll be sure to communicate that also to the Secretary Sutters and her team as they are continuing to put their, put our plans in place for vaccinations. All right, this question from Finn is about the climate bill, how that will work when cities play a role. So in terms of the Next Generation Climate Roadmap, which is the sort of the name for the climate legislation, just to remind everyone where that's at, the legislature passed it in basically the end of the last session, and it passed on a bipartisan basis, which is great. Unfortunately, Governor Baker vetoed it, and so then that's why it didn't get into law. We started a new legislative session, and the first thing we did actually was to bring that same bill back to the floor. Both the House and Senate did that last week, and again passed overwhelmingly, and is now back on Governor Baker's desk, the same bill. So again, Governor Baker now has to decide what to do, but if he were to veto it again, we will just override his veto. We couldn't do it last time because the session ended, but now we can. So one way or another, we will make sure it becomes law. In terms of the reporting, I'm not sure to Finn's question directly in terms of exactly what role cities and towns will play in that, but mainly it has to do with the state government. There's now going to be a target of getting to net zero carbon emissions by 2050. So that would be the first time that goal, that actually is a legal requirement, is in our statute, in our state law. But now there will also be requirements along the way. So it won't just be the 2050 goal. We're also going to have 2030, I believe, every 5 years. And there has to be substantial reporting from the Department of Energy Resources and other state agencies to make sure we know, how our state's doing in meeting those goals. So not just in the aggregate, but across all different sectors of the economy. So we can see how we're doing in terms of energy, electricity generation, transportation sector, housing sector, commercial versus residential, industrial. So we will have a lot more information. So that's the main reporting, that's included in there. But if there's follow-up questions you have or others have in more details as to how that would work, just reach out to me, to my office, and we can dig into that some more with you. Are there any other bills you'll be filing that you'd like to share with us? Yes, there are actually. So thanks for that. I am filing a bill to make mail-in voting permanent in Massachusetts. It was a huge success, last year, having both early voting and having no excuse, absentee ballots, mail-in voting. First time we ever had it in Massachusetts. It was a challenge for our city and town clerks, and I'm enormously grateful to them and their staff and volunteers. They rose to the challenge, but we did a great job. And, we had the highest turnout ever, in Massachusetts, certainly on a total basis, and I think also on a percentage basis, or at least in many, many decades. So I'm filing a bill to make that permanent. I know, a number of other legislators are going to do that as well. So I'm sure that'll be one of our definitely hot issues this session. The legislation dealing with, we talked about universal access to high quality, affordable early ed and childcare. I'm also working on a major piece of legislation dealing with single-use plastic waste. We think that now that the climate bill, again, is hopefully going to get done in the coming weeks, that there's going to be an opportunity to really start focusing also on some other major environmental challenges, particularly around waste and sustainability, and a big part of that is plastic waste. So I'm working with Representative Michelle Chicolo, who's very passionate about this in the House, and she and I founded a new caucus called the Zero Waste Caucus last year, and that's going to help us drive an agenda in this area. And Conservation Law Foundation has also been a great partner in this effort, along with other environmental groups. So that bill will be an omnibus plastic waste reduction bill, kind of taking the best ideas we've seen from other states and other countries, trying to bring all that together for Massachusetts. So we're excited about that bill. I'll be refiling a lot of bills that I filed last session. I think last session in total, we had over 100 bills that I was the lead sponsor of. Some of those became law, which is great. But many of those will refile, and then we'll file some new bills. And also I'll be co-sponsoring, a lot of great bills that my colleagues in the House and Senate will be filing. So that's another way that I can help support good legislation. All right. I think Tom's indicating that we've made it through, I think, all the questions and feedback and comments. So right around a little after 8 o'clock. So that's perfect timing. Thank you so much, everybody. Thank you for attending. Phenomenal questions. And so appreciate all your interest in what's happening, in our communities and in our state. And stay in touch. You can always call my office. Although we're working remotely. We get your messages. We'll call you back. You can contact us by email, jason.lewis@masenate.gov. You can certainly come to our virtual office hours every other Friday, or we can schedule a separate meeting with you if none of those are convenient for you. All right. So thanks a lot, and hope everybody stays safe, be well, and thank you again for attending our town hall.